In recent Rural Health Report of 2014, it states that ER doctors are feeling burnt out, there are LPNs but no nurse practitioners, and that communities feel powerless because they don't have the resources to draw someone in. How would you help communities of this constituency draw in new staff and ensure that their facilities stay open?
Okay, thanks, Kevin. Part of the Alberta Health Plan, or the Health Report Plan, is, of course, local autonomy, more local autonomy. Local autonomy is going to help, as I said, those boards have to be accountable, but also be able to handle the budget there. The 1,600 management positions that the government plans to reduce in the next 3 years will free up some dollars, of course. I think we need some sort of a program, maybe at the university level, where we're enticing more doctors and nurses out into rural Alberta, where maybe we're paying some of their tuition to begin with, and they spend so many years in rural Alberta before they can leave.
Okay, attracting doctors and nurses to our rural health facilities. One of my understandings of AHS is that you're actually not allowed to advertise outside of your facility. You have to put a posting up. You can't really advertise in papers. So it's pretty hard to get the word out, especially in a small community like St. Paul. And you'd like to be able to advertise it in Edmonton and get some young people moving back out to our areas. Wellroad's position on rural healthcare is having the money funding follow the patient, rather than filter down through 52 pages of AHS upper management from their org chart. We'd like to get the money coming into the hospital at the rural level, being dealt with by a local board and local administration, so that they can spend the money as they see fit, where they see the need. The money is there in healthcare, it's just not being allocated properly. And I think if we can address some of the, get rid of some of the consultants and upper management in AHS and get the money into the hospitals where it's needed, we'll probably be able to deal with this issue. Thank
you. Again, I will admit that I'm not an expert on the health field. But I'm aware of a few things related to our community in Lac-Cartiche. One, I'm aware that there's a move back towards local health board. After some years ago, they were dissolved and all the control was centralized in Edmonton. I'm not sure about the wisdom of continuing to change these things, but I strongly support local involvement, local control where it makes sense, and I think it does make sense there. I also know that in our Lac-Cartiche community, there was a need for a dialysis unit. It was a long struggle, I'd like to get that available, and so now we have one, and it's in a bus. The bus is parked right outside the hospital, so a friend of mine works there, goes to work every day in the bus. So I think definitely some more resources are needed for them. I know it's not an easy, we all want good health care, I know, but it's not an easy problem. There's lots of things to consider. So, again, something where I feel to answer intelligently, I want to be